I've gone through opiate withdrawals probably 3 or 4 times. Probably, I mean, mostly it was off hydrocodone and oxycodone, even oxycontin. I was always kind of in the like 50 milligrams, 60, 80, 100 was pushing it, but I was always kind of in that 50, 60, 80. You know, in the morning I would have about 30, 20 milligrams maybe, and then I'd have to dose one more time. You know, like 3 or 4. Middle of the day I had to have a little bit more to get through the rest of the day when I was self-medicating, you know. And then I've been to places, you know, where you do the methadone treatment. Methadone treatment is very weird because you only dose once in the morning and then you have all day to go get through, which I don't really think they understand how it works. But usually addicts need to dose 2 or 3 times, you know. Once in the morning can kind of take away all your energy and leave you with a whole day. So that's why instead of methadone, I kind of advise people to get into KRATOM, where they're managing their symptoms, they're managing their recovery, they're managing their medication and, you know, doses and everything like that, because nobody really truly knows how you feel except for you. And honestly, a lot of doctors don't know they don't know much about KRATOM at all. So again, I advise you to look at all the resources out there when you're going through opiate withdrawal. KRATOM is probably going to be your best bet if you're like right now you're in bed sick and you're withdrawing and you have the you know, the creepy crawlies, the skin twitches and the muscle twitches and the joint pains, you know, and you just have these some of those. Woo! Terrible. So, I mean, opiate withdrawal, yeah, that's I believe it kind of starts first. It's like, you know, low energy, anxiety, panic attacks, sweaty, yawning a lot. You're going to be like kind of teary. You're going to get teary-eyed. You're going to get chills a lot of chills, a lot of yawning and sweating. Emotionally, very on edge, and you know, it's very weird what it does to your emotions. Your emotions are so weak and just so random. You really don't have much control over your emotions, basically is what I'm saying. When you're in opiate withdrawal, you could watch TV and you could cry off a commercial. You could watch a TV show and it just really resonates with you and you get sad and you cry, and I was just like, what the hell, you know? How am I crying over a commercial, or how am I crying over an episode of How I Met Your Mother? But it just really, I don't know, man, it really messes, your levels are just so down and out of whack, and, you know, it's pretty terrible, but it comes back. It takes a couple days, maybe 2, 3 days, then you're going to expect post-acute withdrawal, which is about 5 or 7 days out. You know, and that's a whole different thing. That's kind of like, again, KRATOM can help with that. But it's just so terrible. You know, you want to talk to somebody too. You want to have a friend or a family member just that you can reach out to that understands what you're going through. Not many people are going to understand that what you're going through. They're not going to understand what opiate withdrawal is. But there is a lot of cases where doctors put people on pain medications. One day they cut them off, and then their doctors send them down the street to a methadone clinic or a Suboxone clinic. and keep them in the system. That's what they want. And honestly, that's the future. The future of being a drug addict is you're in and out of the doctor's office. You're always going to the hospital. Every week you go to the hospital for a doctor's appointment. You're on 5, 6, 7, 12 medications. And you're just going in and out every week or every month. And you're paying them a lot of money. Your insurance is paying them a lot of money. There's no money for them if you're better. If you're healthy and you are taking control of it yourself, there's no money for them in that. There's no money in them telling you lifestyle change, diet, exercise. It's what you eat. It's what you're putting in your body, and being active and focusing on healthy things and growing and developing. They're not going to tell you that stuff. They want you to keep coming in and out, paying bills, giving them money. You being healthy does not pay for your doctor's summer vacation home. So, yeah, you're going to have a lot of insomnia. You're not going to be able to sleep. You're going to have the restless legs. You're going to be kicking your legs a lot. Again, KRATOM really helps with this. SSRIs, antidepressants, when you're in withdrawal, I don't think it's a good idea, because then you're going to have too much serotonin, and then you're going to be a little bit, kind of just adds to the uncomfortableness, and it just kind of makes you even more uncomfortable, gives you energy, and you feel like shit. So, benzos will help you if you're in withdrawal. Don't mix your benzos and your opiates. Very dangerous. That's going up and down at the same time, and your body just sometimes can't handle it. Don't gamble with that. But yeah, some Xanax or something like that. I forgot what this other medication is called, but it'll help. Gabapentin helps a little bit. Neurontin, things like that. Muscle relaxers, kind of. But it also, again, it's gonna kind of make you uncomfortable even more. Muscle relaxers and antidepressants are gonna make you kind of feel a little bit weird and a little worse sometimes. Lots of sweating, lots of yawning, lots of just uncomfortable, man. You're just gonna be so uncomfortable. And like I said, KRATOM is probably your best bet with that. You just really want to wean yourself down and off of what you're medicating with. So, your best bet for those last 3 days that you're self-medicating, wait until you really, really, really need it. Then take the last of your codeine or your opiate. But I would wait, like 5 to 6 hours afterwards, and then maybe you can take some KRATOM and see how that works. But if you wait 8 to 12 hours after your last opiate, then you take some KRATOM, you're going to have a better bet, because most opiates don't bind to the receptor like receptor blockers, opiate blockers, methadone, Suboxone. Those are receptor blockers. KRATOM just interacts with it and lightly connects to those receptors. It doesn't block it or anything. So don't take KRATOM with Suboxone and methadone. It really won't do much. But there are some benefit. There are sometimes, everybody's different, but sometimes KRATOM will help if you're on Suboxone or methadone. Methadone blocks it. You're wasting your KRATOM if you're taking it with methadone. Suboxone sometimes, same thing. It kind of blocks it, and it doesn't do much at all. So, yeah, you're going to want your system to be pretty clean and, start withdrawing and detoxing. Then take some KRATOM. And I'm telling you, start with 4 to 6 grams. Can be in powder form with warm water or capsules. Give it an hour or two. Go for a walk. Drink lots of water. If you get nauseous, lay down on your back, lay down and deep breathe for 2 minutes. It'll go away. You'll be fine. Yeah, I mean, opiate withdrawal is just very, very, very terrible. And that's one of the main things people keep using. People keep using, and they're chasing the dragon or whatever. But they're just always, they're addicted, man, and they're just in that system now. They're in that pattern of behavior now because they're fighting the sickness. That's what they're doing. They're trying to just not get sick at some point. At some point, they're just taking whatever they're using just to not go into withdrawal. So they're just trying to avoid withdrawal. And yeah, you're just going to get teary-eyed. You're going to yawn a lot. You're going to be uncomfortable. It's so terrible, and it'll help. You know, if you get out of it, man, you know, it's great because you get out of it and you're like, wow, you know, I feel normal now. I feel normal. I feel stable. And that will help you not want to go back. Going through the withdrawals is going to help you just, I don't want to go back. I don't want to do that again. I don't want to have to do that again. Opiate bowel syndrome, too, is a big one. Opiate bowel syndrome. So when you're taking all these medications and opiates, your whole body calms down, chills, and relaxes. So even your organs are going to calm down a little bit and relax. And it's not going to be, they're not going to be working as efficiently and as quickly. Your systems are not going to be working. Your digestive system, everything is going to kind of slow down a little bit. So you're going to have some stomach pains, some cramps, and stretching definitely helps with all of that. And, you know, there's some supplements out there that you can take. Again, KRATOM really helps with this too, with opiate bowel pains and stomach pains and things like that. But yeah, lots of, you know, cranberry juice. And yeah, look for some kind of laxatives. Make sure you're regular and you're normal, and make sure you're drinking tons of water, fruits and veggies, man. Just stay intaking nutrition. And again, connect with somebody that might know. You know, connect with somebody that knows about this, that has been through it. You know, you might think those people are junkies or weirdos or druggies that you don't talk to, but they might have some information for you and some advice for you. Again, a lot of people get on these medications and their doctors do not explain to them what withdrawal is. They do not explain it. And then one day they're sick and they're just going through withdrawal, physical, mental. And some people do indeed commit suicide because of opiate withdrawals. A lot of people on heroin go through withdrawals and end it. They cannot get through it. And that's terrible. It's a terrible feeling, and it does happen to people when they go into withdrawal. They do think suicide. They do also drink. A lot of people will drink. I'm telling you right now, if you drink alcohol while you're detoxing and withdrawing off of opiates, it'll make things worse. It'll make things worse. Yeah, sure, it might kind of numb the pain or mask the pain a little bit for a couple hours, but you're going to wake up at 3 a.m. feeling terrible, shaking, you know, restless, sweaty, anxious. It's terrible. So don't mess with alcohol when you're going through withdrawal. It's terrible. Ugh, it's just horrible. Try to stack that sober time. Maybe sit down in a nice, comfortable area. Make sure you have food. Make sure you're comfortable, you're warm. Shelter, warmth, you know, food, and just you're sick, you know, you're getting through, it's like the flu, like a killer flu, but it is very, very intense. And like I said, man, maybe 3-4 days, and then get through 7 days, get through 10 days. 10 days you should be pretty damn good, but I'm telling you, if you handle it well, you can get out in 3 or 5 days. And you'll be out of the woods. Not completely, because you'll have your post-acute withdrawals, you know, a week or two later. And again, KRATOM will help you with all of that. Medical marijuana can help you with that. Low doses of psilocybin mushrooms can help you with all of that. Yeah, there's remedies out there for you, but the main thing, man, is just to take control of your addiction. Take control, and remember when you're going through this pain and withdrawal, it's that pain is you transforming. Your life is transforming and changing. Remember that when you're going through all the pain and the suffering. Remember that you are transforming and you're leaving behind the old drug addict you used to be, the old, weak, uncertain person. Let go of who you were. Make room for the person you will become. And then you'll have gratitude, man. You'll have so much gratitude for just feeling normal and stable, and all the simple things, all the small things you'll just love, and you'll be so thankful for things. You know, once you make it out of that dark place, you know what gratitude is, and you know what to be thankful for. I love you a lot, and I hope you get through whatever it is you're going through. Again, look for smoke shops, herbal shops, tea shops. They will have KRATOM. It is legal, and it can help you with your withdrawals. Again, you got like 3 or 5, maybe 2 weeks. And yeah, why go back once you get through these terrible withdrawals? I love you. Be well, treat each other well, be kind, lift each other up. Good luck.